I just love the sessions, the collaboration with the other care managers that you get to meet and hear their stories, and then just the whole support. You get to meet your account managers, your team there. You get to catch up on the latest trends and the new products of MCG. So I appreciate that a lot. And of course, you get to have fun.
I'm actually looking forward to different ways that we can utilize the program, meet different people, figure out how that they've used the program to, obviously, we've got lots of patients that are entering the emergency rooms. And so really my goal is that we get the right order at the right time for the right service.
Just socializing and talking with people to see what they're doing is probably the best part of the forum.
Honestly, I am looking forward to the networking. So I was told that there's 4 hospitals that are live with the admission for indicia case management portion, and we're the last incorporated 4. I was told that there was one other one that's using Epic, and they have something else going on their side that they're reviewing and looking forward to helping them capture ER admissions. So as you know, the ER is like a revolving door. And so it would be nice to be able to see what they're doing on their platforms, to see how they're catching those admission versus observation, and seeing what they're doing to prevent denials for the level of care. So I'm actually really excited to see what other facilities are doing.
Really collaborative atmosphere between payers and providers, which I like, and opening up the door to see where kind of innovation in that space where we all need to monitor and make sure people are getting the right care, right place, right time. To see people coming together from kind of both sides of the fence to do that through MCG is nice. It's a very neutral playground here. So it's very nice.
Well, the best experience has been listening to the speakers. The speakers have been awesome, and they're telling you like actual real life case experiences of this is where we were before we started using the product, and this is where we are now, and this is what we're seeing as the result. And to me, that speaks volumes, when you get to hear a real hospital system that's incorporated this and has the type of results that they're seeing because of incorporating one of the products.
Learning about similar success stories, what I can bring back home. And I actually was attending one of Dr. Omer's presentation on decreasing length of stay, which we are struggling with. And I was very impressed. I'm excited to bring that back home and materialize on success there. So similar stories, networking with people. And if there is an interest in our program, and if we can help support other peers and organizations, I would be more than glad to do it.
There's so much new energy, right? People are so excited to see each other face to face. And it brings a whole new level of what it's like to share ideas and collaborate. We're used to Zoom, we're used to Teams. Everybody knows that now. And it's gotten old. So to sit down with people face to face and share a meal and have a conversation, it's been a wonderful thing. I have to say that I really appreciated the roadmap and hearing where things are going, and also the Medicare compliance session with Magellan RX. I think that everyone can agree that Medicare is challenging at best, and navigating CMS rules and regulations is not fun. And to hear how a big company like Magellan is partnering with MCG and using that solution has been really helpful, especially as I think about ways that it can impact the work that we're doing and change it and make it a little bit more efficient.
It's been really fun. I think I'm going to go again next year. Met some payers, so it's also been nice to see them in person instead of just talking to them over the phone. And I've met a few colleagues from different hospitals, which uses MCG and kind of is the same with how we do it at Cedars-Sinai. So it's been really fun.
Learning best practices. I love the idea that I could learn a best practice. The ability to kind of meet with other healthcare systems and talk to them about what some of their challenges are. Has been really helpful for us.